What if someone randomly gets up and sees a white patch over their skin, over their body? The attention is drawn to Google. We first search and we come to know about a condition called as vitiligo, and due to its incurability, due to its failure rates, due to all the recurrences and failures, we get scared and the stress level just goes up. In this video, we're going to talk about everything that looks white is not vitiligo. So maybe that's not vitiligo. We're going to talk about most of the examples which looks white, which is treatable, which has very good results, and it is not vitiligo. Although vitiligo is a condition which is best managed with the ethics and the principles given in Ayurveda, nevertheless, let's understand maybe it's not a vitiligo. Namaste everyone, welcome to Jyovis Hospital of Ayurveda. Today, let's start with the first example. This is a common fungal infection which is tinea versicolor. Commonly affects the chest and the back. It is slightly scaly. If you scratch it, it is slightly scaly. A common fungal infection, and it is well treated with the fungal therapy. As per Ayurveda, once it's gone, the patients never develop such kinds of tinea versicolor. With an authority, Ayurveda says that it cures the root cause which is in the intestines when it comes to such tinea versicolor, which in Ayurveda is called as Sidhuma Kushta. Moving to the second one, this is one of the type of lichen planus which is lichen sclerosis. It occurs at the genital area. It often has pain and itching, and pain as if some fissure or cracks are there, and it is a condition where serious action is needed, which needs a lot of discipline and proper medications time to time. The third one, very common, it is the Petrasis alba. Petrasis alba is a low-grade form of eczema. It is also called as the atopic dermatitis. So this is a very common condition. Many a times it is misdiagnosed as seborrheic dermatitis or psoriasis, but very important is Petrasis alba needs quick treatment, although a low-grade form of eczema. Next one is the IGH, idiopathic gutted hypomelanosis. Occurs mainly because of sun exposure, and mainly it is seen in the chin and the forearm area. The next one is Divis depigmentosus. This is usually a birthmark that occurs in the first few months of birth. It has jagged edges, and it doesn't turn any hair into white, but it is just a patch that stays. Through Ayurveda, if we work out, definitely we see that it does reduce. Moving to the next part, this is discoid lupus. It is a form of a cutaneous lupus and needs quick and serious action. And next one we see commonly pinta. Pinta is a very rare form of condition, and it is seen in the Southern America. The next one is progressive macular hypomelanosis, which is exactly similar to tinea versicolor. The only difference is if you scratch, there is no scales. It is something without scale. The condition is simple. It is similar to tinea versicolor. Next one is secondary syphilis, which is a sexually transmitted disease preceded by a genital sore. We see it a common case. And the next one, it is the morphia, which is the hardening of the skin. Skin becomes hard, and before it leads to permanent damage, it needs to be resolved. So these are most of the examples where the condition becomes white, but it is not vitiligo. Whether it is vitiligo or not, Ayurveda offers a wide range of treatment options and positive results for hypopigmentary cases. We need to have a Shodhan Karma, need to find out the root cause through examining the levels of Vat, Pitta, Kapha. In over 50 plus countries, we see positive results when it comes to the management and reversal of hypopigmentation cases. So choose Ayurveda. Any doubts, any questions, write them down in the comment section below. We have a lot of videos on vitiligo. The causes needs to be stopped. The treatment needs to be rushed immediately, and we see through Ayurveda very good change. So choose Ayurveda, look impressive, be progressive.